So let's talk a little bit about how we diagnose carpal tunnel syndrome. Honestly, the majority is just listening to the patient and hearing about their symptoms. This, combined with a good examination of the hand, will often yield the diagnosis. So what are those things we listen for? It's primarily numbness, tingling, burning, or a shooting or electrical type sensation in what we call the median nerve distribution. So that's the thumb, index finger, middle finger, and half of the ring finger on the palmar side. Additionally, there are a few in-office physical examination tests that I do with my patients to determine the likelihood of carpal tunnel syndrome. If there's any doubt as to the diagnosis, we usually move on to formal testing. The first is a nerve test called an electromyography or an EMG. This test is usually performed by a neurologist and involves small electrodes that they hook up to your arm, and they actually measure electrical currents as they move down the nerve. If you have any pinching of your nerve, that electrical current will slow compared to your normal side. A different and newer way to diagnose carpal tunnel syndrome is actually with ultrasound. So we use an ultrasound device to measure the cross-sectional area of the median nerve as it goes through the carpal tunnel. And that's really about it. The combination of all of this information will usually yield a diagnosis of carpal tunnel syndrome. If you'd like to learn some more of the specifics, or even how you might be able to determine if you have carpal tunnel syndrome on your own, check out my next video.